Hello and welcome to topic 9 or module 9 if you like, and this one is on mental health and human rights. Our objective is to increase our understanding of human rights for people who are living with mental health. I'd just like to caution you to begin with that mental health is discussed in some documents as a disability, and some students in the past objected to that. They're not happy with that. But I suggest that it's only described that way within the definition that a disabled person means a person unable to ensure by himself or herself wholly or partly the necessities of a normal individual and or social life as a result of deficiency, either congenital or not, in his or her physical mental capabilities. And I'll have more to say about that in a moment. The guiding principle in this area is the Declaration of the Rights of the Disabled Persons. That's where that objection comes from. So the human rights and social justice are the foundation for working with all people, and in particular marginalized groups. And in this case, we are saying that when you have got mental illness, you are at risk of being marginalized, and we know that around the world that is common practice. So this declaration states that, bearing in mind the necessity of preventing physical and mental disabilities and of assisting disabled persons to develop their abilities in the most varied fields of activities and promoting their integration as far as possible in normal life. And that is in the preamble. And here I highlight one of the leading organizations in Australia in assisting people with mental illness, particularly depression, and that is Beyond Blue. And I go back to that issue again of mental health, whether it's a disability or not. I want to state that if you are living with mental health and you are managing to go about your life perfectly, you should not consider yourself to have a disability. But in some cases, we have seen that mental illness can prevent you from going about your normal life. So the focus here is on ability. If you've got the ability, nobody is forcing you into the category of disability. I think that's all I want to say for now, and I'm happy for you to discuss this further in the forum if you feel very strongly about that particular point. Another important factor in working with the mental health is the issue of culture. Discrimination is a very important factor when you're dealing with culture and mental health. In a number of cultures, mental health is seen as something that could be evil, that you are in communion with the devils, and maybe you did something wrong in the past, and therefore you're paying the price for it. And in that case, people with mental health can be locked up or chained or expelled from the community. So that kind of discrimination does happen in a number of countries and a number of cultures that I don't intend to name for now. But there could be other situations where if you have got mental health and you're hearing voices, that can be seen as something that's divine, and you are communing with the higher powers, and therefore you might even be treated with special respect. So it all depends on how these things are interpreted. But in this case, we are emphasizing that as social workers, you need to be aware that there could be those different interpretations in different cultures, and also those kind of attitudes can affect the way people seek help. That also includes the stigma that could be attached to mental health, and how people might be living in denial because they feel that it is not only embarrassing for the person affected, but for their entire family and at times even their entire community. There are also inequalities that we notice in mental health in a number of countries, and probably Australia is no exception. There is more funding provided to general health issues, and a lot less resources are provided for mental health, just because it may not appear as urgent as other health that might be issues that might be either communicable, or people might be injured and might be bleeding, and if they're not attended to immediately, they could die. So those sort of health aspects do tend to get better funding, and the campaign is ongoing to get more resources available to mental health. So according to World Health Organization, violations of the rights of people with mental health conditions include overcrowding and unhygienic conditions, violence, abuse, harmful treatment, and neglect. And so that's a summary of the key issues that are identified in mental health facilities and services around the world. Now, something else that is emphasized with mental health is that since the determinants of mental health are very broad, it's impossible that the approach is also broad, and therefore not just mental health or health institutions are involved, but a wider services need to be brought on board, and that include education, social welfare, where we sit, labor, housing, and the judiciary. And you can see all these have got very direct impact. If, say, take education, if people are not being taught properly about understanding mental health, and also accommodating people with mental health issues, then they will be doing them a huge disservice. I will not mention social welfare because we all know about it. Labor, we are talking about issues like discrimination in employment. Housing, absolutely critical. If you are experiencing mental health issues, you might not be able to access housing. And as I mentioned, in some places, people are chained or locked up. So issues of housing are absolutely critical. The judiciary is important too, in that they get involved in issuing the orders, like for treatment, whether people should be treated or not. And in some extreme cases in countries like the Soviet Union, they used to sentence people to jail for issues of mental health, or sometimes have people who are political dissidents claims to have mental health, and therefore again locked up in psychiatric hospitals. So a lot of abuse for people with mental health, and even then in that situation, abuse of people who are otherwise well, but accused of having mental illness for expressing point of views that are not popular with the powers that be. World Health Organization has issued a comprehensive mental health action plan 2013 to 2020, and some of the key issues here are strengthening the effective leadership and governance for mental health, providing comprehensive, integrated, and responsive mental health and social care services in community-based settings. And I keep emphasizing the importance of community-based settings. They're very important in terms of addressing stigma. In the past, when people with mental health would be considered as dangerous, they would be locked up. In fact, in some cases, just show signs of mental health and you are locked up in an institution for the rest of your life. So closing those kind of institutions and treating people in the community, at least here in Australia, has been a major step forward. And just to talk of implementing strategies for promotion and prevention in mental health and strengthening information systems, evidence and research for mental health. All good stuff. Now, abuse of mentally ill is widespread. I have mentioned in a number of countries in the world where that is so widespread that for the people there it seems completely normal. But even here in Australia, it does happen. I have talked to people when I've been doing counseling, and when I suggest they go to hospital, they tell me, you don't really understand. Mental health wards get assaulted by other patients, and cases of rape and physical assault are unfortunately very common. And this one here is an example, of an extreme case from America. This Hollywood actress, Frances Farmer, was a famous actress of her time, before the time of most of us, I guess. You're talking about 1940s. And then she suffered from a series of relationships breakdowns, and she was addicted to amphetamines for weight control. And then she was admitted to the hospital, where she was repeatedly raped by orderlies, prostituted by the hospital staff to soldiers from a nearby military base, and given all sorts of shock treatment. So her personality, her career, they were all destroyed. So it's an extreme case for sure, but it also says that there has been a long history of people in mental health institutions being abused. And being famous is no protection. So, what can we do as social workers? We do have a major role in supporting and advocating for people with mental illness. And as mentioned before, community-based programs need to be promoted much more because they help in treating people within their natural settings. The minute you are moved from your natural setting and you are put in an institution, apart from the risk of abuse, it can also be confusing and further complicating your situation. So there is stigmatizing, easier for the person to reintegrate back into the mainstream of society, and what can win the point in terms of talking to the government is they are cost effective. And for people who campaigned here in the 1970s and 1980s for deinstitutionalization in Australia, they won on the basis of convincing the government that it was more cost effective to do so. Unfortunately, I think in many cases the government took that to mean they can withdraw all the funds and put them elsewhere. So a lot of people who were then taken out of institutions were not looked after as well as they should have been. Continuing with the role of social workers need to take the lead in the role of social aspects of mental health. Because we are not involved in prescribing drugs, it's very important that we play our role of social aspects of mental health much more than we currently do, and convince everyone that mental health is more than psychiatry, and therefore it needs this multidisciplinary approach, which includes promotion of mental health and well-being, and also prevention of mental illness, addressing issues like stigma and discrimination, and social support and social reconnection. All those are important aspects that we can play a very, very important role. What has been also pointed out by the United Nations is that there is what they call a treatment gap, and that is the number of people not getting appropriate care. In some cases, it can be as high as 90%. 90% of the people not getting assistance in psychiatric facilities, and that's a role that social workers can play. This 90% of the people who are not getting that treatment are people that we as social workers can help, can work with. And it's important for you to also consider who are these 90% who do not receive psychiatric treatment. And if it's in a place, for example, where you have to pay for treatment, who can do that? Who can access that? If the services are only in urban areas and not rural areas, and in some cases, in some countries, that's where the majority of the people live, then who is going to access that treatment? So consider those sort of factors. So what factors are access to treatment, and what role can social workers do? What can they do with these 90% who are not accessing the mental health services? So World Health Organization states that the entire mental health system needs to be reviewed and each component modified as appropriate to each country. So they're not saying this plan, this comprehensive plan, can be necessarily adopted wholesale in every country. They're saying these countries need to look at what they have and what needs to be done in line with that broad program. And this journal of psychiatry in America reported that 81% of women with psychiatric disabilities have been physically or sexually abused in institutions. So again here, the gender issue comes into play. If women are being abused here because of their gender, they need extra protection. They need to be put in wards that are secure, particularly from other patients with mental illness. Sometimes it has been the staff, but more often than not, it's the other patients. What is to be done? I think that's something that we all need to develop an awareness of, because we need to remember that any one of us can become mentally ill, and we can find ourselves in this situation. So if we are not going to advocate for the people now, who is going to advocate for us when our turn comes? So what can you do? It's important to always observe the Australian standards and the standards in your respective state. With New South Wales, the Department of Health Charter for Mental Health Care in New South Wales states that every person has the right to mental health service that, among other things, respects human rights. And with the National Standards for Mental Health Services outlined, the national standards that should apply to all mental health services across Australia. And you have that website. If you want to visit that, then you can see what sort of national standards we have. Again, it's important to observe international standards, in particular the International Bill of Rights, which includes the International Covenant on Civil and Political Rights, Universal Declaration of Human Rights, and International Covenant on Economic, Social, and Cultural Rights. So if you look at Article 1 of Universal Declaration of Human Rights, it says all people are free and equal. Therefore, people with mental health are entitled to the enjoyment and protection of their fundamental human rights. And that can be the basis of your advocacy for the people you work with who might be living with mental health issues. Continuing with the international standards, there are other articles that can protect people living with mental health, and they include the right to health in Article 12 of International Covenant of Economic, Social, and Cultural Rights, Article 7 of International Covenant on Civil and Political Rights, that talks about protection against torture. Because if people are being raped and being maltreated, that amounts to torture. Also, this comment on Article 7 that says that measures on prevention of abuse in psychiatric hospitals need to be reported to the UN under International Covenant on Civil and Political Rights. International standards also can be found in mental health care law, which provides 10 basic principles. One is promotion of mental health and prevention of mental disorders, access to basic mental health care, mental health assessments in accordance with internationally accepted principles, provision of least restrictive type of mental health care, self-determination, right to be assisted in the exercise of self-determination, availability of review procedure, automatic periodic review mechanism, qualified decision maker, respect of the rule of law. Again, this can be used by you as your guidelines in how you work, and also in how you can advocate for people who are not having the appropriate treatment. There are also the professional standards that social workers and other professionals need to follow. We don't provide any medication, as I mentioned, but our domain is clearly stated by ASW, is social context and social consequences of mental illness. And so that's where we need to put our effort, and also to emphasize the importance of that in mental health treatment and prevention and response. So just to emphasize that point, we should always work within our professional organization code of ethics. Human rights and quality of life. Human rights is an important aspect in terms of promoting the quality of life for everyone, and individual health can deteriorate through neglect or violation of human rights, or can improve through favorable health policies and programs on human rights. So this is just emphasizing the important role that human rights can play in terms of promoting good mental health for everyone, because people who have their human rights abused are vulnerable to mental illness. So we have seen people who are locked up in detention here being vulnerable to mental illness, and therefore that has been used as one of the arguments for releasing the people. Another important aspect which broadens the area of mental health is that physical environment is also important in improving and promoting mental health. So this quote here from these people, Stanford and Candy, says that the strength of evidence varied and was strongest in the effect of urban birth. If you're born in the urban area, your risk of schizophrenia, rural residents, risk of suicide, particularly for the males, neighborhood violence, housing and neighborhood degeneration and neighborhood disorder. The strength of the evidence for an effect of poor housing and mental health was weaker. This is Clark, Myers, Stanford, and Candy, and I've got the reference that I want to read and learn more about the impact of physical environment and mental well-being. So in terms of reflection, how do you respond to people with mental health? Do you do that with compassion or fear? A lot of people respond with fear, empathy, pity, or avoidance. Do we respect the rights of people with mental health in Australia? Why is community treatment more effective in some situations? Which situations do you think hospital admission is preferable? So in which situations do you think hospital admission is preferable? And I'm thinking of things like acute cases where people are at risk of harm to themselves or harm to others. What are some of the myths you know about mental health? You may want to discuss that among yourselves on the forum or with people that you live with. This reference, Clark and others, is the one about physical environment and mental health. There's further information there on social work and mental health, some YouTubes you can watch, some information about CBT and so forth. So that is it for now, and thank you very much for staying with me. I think there's only one more topic after this. Thank you. Bye-bye.